Brought to you by GTA. We start with you.
We don't have a big outbreak like we have back in August. That's a huge difference just because of the vaccination.
The vaccine and testing across the island. From the Northern Public Health Clinic to drive-through testing at the Tsubaki Tower and Tizen Old Carnival grounds and over at private clinics. It's been all hands on deck to test the potentially exposed people linked to the two COVID-19 clusters. Dr. Hao Wen with the Governor's Physicians Advisory Group says we aren't out of the woods just yet, and they will have a better idea by next week.
And so far, the number is not big. Yesterday, I think we have zero. So we tracked down a lot of people. So far, so good. We hospital admissions still at 3. So like I said, it's a huge relief for us. And also, the governor and public health went out there really at the beginning. So we want to do contact tracing and people respond. So it went very well.
Dr. Wen is hopeful this response will be maintained for future clusters, as he also noted that over 60,000 people on island have been vaccinated, meaning that we anticipate reaching half the island population fully vaccinated before the May 1st goal date to reopen the island for tourism. Guam is currently at a moderate risk level 2 by the CDC. However, DPHSS PIO Janela Carrera feels confident we will contain the exposures from the two clusters.
Right now, I think what we're doing, especially with offering the COVID-19 testing for the two cluster cases, we've already done 693 tests, and then we also have testing today in Tizen. And we have a robust contact tracing and contact investigation team. So I think we're very confident in our ability to do contact tracing for the two clusters.
According to Carrera, the CDC calculates each jurisdiction's risk level through a formula that follows incidence rates, which is the cumulative cases over a 28-day period per 100,000. Currently at a level 2, Guam's incidence rate is between 50 to 50 cumulative cases. And the next step in order to upgrade to a low-risk level 1 would be having less than 5 cases per 100,000.
If we can, continue to remain vigilant and, work together as a community to bring that incidence rate of COVID-19 down, maybe we can meet that criteria in the next round.
Carrera doesn't believe our current risk level will affect the reopening of our prime industry.
I think the fact that we were able to go from a level 4 to a level 3 to a level 2 says a lot about our efforts to reopening tourism.
And Dr. Wen tells KUAM the island can expect new quarantine guidelines to be announced as the PAG has already provided the governor with their recommendations.